Hi, my name is Morgan Gutzman. This is a presentation on my doctoral capstone project titled Promoting Mental Wellness in Emergency Medical Services Through an OT Perspective. The capstone timeline was from January to April of 2025. My capstone site was Schoolcraft College in Oconee, Michigan, specifically in the Emergency Medical Technology Department. My site mentor is Eric Schrenk. He's an associate professor in the EMS department. He has a BAS and he's a paramedic instructor coordinator. He has a lot of experience educating EMS providers and students. The ACO concentration areas that this project focused on are education and program development. The purpose was to provide mental wellness resources to EMS students, EMS providers, and their support systems like their family, friends, and loved ones, to help support occupational functioning, increase resilience, and advocate for supportive workplace environments. So EMS providers work in high stress, high stakes environments. They're constantly exposed to stressful and traumatic incidents. And as a result, there's an increased prevalence of mental health challenges in this community. Unfortunately, there's a lack of education in their training on the psychological toll that this job takes before they start their career. This leads to providers feeling unprepared on dealing with those psychological tolls. Occupational therapy is well equipped to support EMS through mental wellness, education, and awareness, occupational balance, and self care strategies. After I disseminated my project on site, I gathered subjective and informal survey information from the 8 paramedic students that I followed throughout the semester, and there was an overall positive change in confidence, understanding, and comfort when it comes to having conversations about mental health. So during my literature review, I really highlighted the increased prevalence of mental health challenges in the EMS community. So in a survey of 4,000 EMS providers and firefighters, 37% of those EMS providers reported contemplating suicide, which is 10 times the national average. 6.6% had attempted suicide, and roughly 10% of EMS providers have post-traumatic stress disorder compared to 1.3 to 3.5% of the general population. So that really demonstrates the critical need for mental health intervention. I also researched occupational therapy and mental health. I tried to research OT supporting EMS specifically. I did find one article which was really helpful, but it does show the unique territory that this project was exploring. And then I also researched barriers. So why wouldn't EMS individuals seek support? And it shows that there's a stigma surrounding mental health in EMS. And lastly, I researched interventions. So what interventions are available currently for EMS providers? Where is there a gap? How can OT fill that gap? But I also researched OT interventions specifically that were evidence-based to help people that have chronic stress, trauma, and burnout. And so things like self-care, stress management, occupational balance, and even just participating in meaningful occupations are all evidence-based. So the literature review did help me make my project evidence-based and occupational therapy focused. I completed a needs assessment prior to the 14-week capstone experience. I interviewed EMT and paramedic students, providers, and 2 instructors at Schoolcraft College. The strengths were debriefing after critical incidents is helpful, peer support and support systems are helpful in mitigating mental health challenges, and that students and providers are both open to additional training and education about mental health. Weaknesses were that there are higher rates of burnout and suicidal tendencies than ever in EMS. There's a lack of education and awareness, and that it's difficult to talk with people who don't understand, and that includes family, friends, and mental health professionals. And that's one of the reasons that I created the social supports systems part of this project. Opportunities included education, so especially earlier on in the training for EMS providers on mental health challenges and how to help build resilience and maintain your mental wellness throughout your career. And the earlier we start talking about those things, the easier it is to break the stigma. Threats included the stigma, limited time, especially for students that are working at the same time. It's hard to find extra time outside of those responsibilities for additional educational things. Also, providers work long hours, so that adds to the time constraint too. Mental health professionals lack experience working with first responders. There's a lack of resources or a lack of accessibility to those resources, and then the cost of treatment, so there's a financial barrier as well. The objectives that I achieved during my capstone were first to develop a knowledge foundation related to educational and adult learning theories. This was to maximize the effectiveness and engagement of my program. In order to complete this, I read 8 pieces of literature about educational and adult learning theories. I also participated in 2 paramedic classes, so I shared research and led discussions about mental health. And then I also observed 3 different instructors at Schoolcraft College providing educational information to students, teaching the students, and that just helped me learn how to best engage with EMS students and providers. Second was to develop a multimedia educational program, including 32 digital handouts and 17 presentations. So there are 6 videos for the student presentation, 5 for the provider, and then 6 for these support systems. And then I compiled a list of public resources and put them all on a website. And then these were related to stress, burnout, and trauma, and then self-care. And they're all tailored to the specific groups, so students, providers, and their support systems. Lastly, I facilitated and presented my project to the 8 paramedic students that I followed throughout the semester, and then my site mentor and one additional instructor there who is an EMS provider. And this was to help enhance their understanding of symptoms and then self-care techniques to improve their overall well-being and maintain patient care. The implications of this capstone were advocacy and education on the role and impact of occupational therapy. So I worked with students and providers who didn't really know what OT was. So this allowed me to demonstrate and showcase OT's unique value and educate them on what exactly OTs do. And then advocate and educate on mental wellness, self-care, and overall well-being that was achieved through the project. And then the unique collaboration between OT and EMS. Like I said, there's one research article I found about this collaboration. So it was really cool for me to navigate this new territory. And then demonstrate the role of OT in high stress professions and how OT can be integrated into community and workplace wellness initiatives. So in conclusion, even brief targeted educational interventions can have a meaningful impact on EMS students' attitudes towards mental health and help-seeking behaviors. I learned and developed research skills, clinical reasoning skills, and communication skills. Future recommendations, or if I had more time, I would have liked to develop an ongoing support like a peer-led support group, skill-building workshops, or wellness check-ins through the workplace. But lastly, the role of OT in addressing mental health in high-stress professions like EMS should be more widely recognized. OT is uniquely equipped to support individuals that work in high-stress professions like EMS, so I think that should be explored more. These are my appendices. So first is the educational video modules. This slide has a sample of them. There's one picture of a slide from each of the 3 presentations I did. So the one on the left is from a student module, the one in the middle is from a provider module, and then the one on the right is from a support system module. There were 17 total, and they're all available on my website. This is a digital handout sample. There are 32 of them. Again, they're all on my website. And then this is a sample of the public resources list that I compiled. There are a lot more on my website, but they're split into those 4 categories. And on the website, there's an icon next to each link that is like provider or student focused or support system focused so that the user knows which resources best fit their needs. And then this is a link to my website and a QR code to the website with all those resources. And then this is the needs assessment I did before the 14-week Capstone experience. It shows strengths, weaknesses, opportunities, and threats. And then this was the informal retrospective pre-post survey that I gave to the 8 paramedic students after I disseminated my project on site. There are 10 questions. And then here are the results. So I asked them about their understanding of job-related stress and burnout before and after, their confidence in knowing where to find support or resources before and after, and then their comfort and confidence in talking about mental health challenges with their peers. This was a poster I made as a visual for me to disseminate my project on site. I just put the hard-hitting information I really wanted them to know. So statistics, definitions of stress, burnout, and trauma, why that matters, or how those things affect their functioning. Provide them with my website so they have access to all of those resources, and then some self-care techniques and tools that they can start using right away. And then I provided them with a folder that had 10 of the 32 handouts for them. I chose the 10 based on the student interests throughout the semester, what they expressed interest in, and then also things that I thought would be really important for them to have right away. And these are my references. Thank you so much for watching.